I'm Dr. Sina Joorabchi. I'm a board-certified otolaryngologist, and I've been in practice since 2013. And I want to talk to you about Tula, who is it good for, why you should consider doing it, and what are the benefits of it. So what is Tula? Again, Tula is tympanostomy under local anesthesia. The idea is we're putting tubes in your child in the office, which scares a lot of doctors, but let me tell you, it's something we can do. So what's different about it is this. It uses a specific anesthetic process called iontophoresis. It's basically putting a numbing drop in the ear, and it's pulsed into the ear canal, into the eardrum, so it's better absorbed. After that 10-minute process, the child is fully numb and ready to go. And this is where you take the actual device, the Tula handpiece, to put the tube in. This device is pretty sweet. Basically, you click the device, and within 1 second, it cuts the eardrum, it dilates it, and it pops the tube in. And this can be done safely in the office with mom at the bedside. No traumatic ripaways, no traumatic tears. Very simple, very fast. Why do I believe in Tula? I like it because of this. Traditionally, when you need to get ear tubes, it's not only scheduling it, we have to coordinate it with the operating room. So there is a long delay getting that kid into the operating room and actually performing the procedure, sometimes up to 3 months. The second benefit of Tula is avoiding that traumatic separation. Let me paint a picture of what a typical OR experience is. We're in the preoperative area and the nurses have to take away the child from the mom. The child obviously doesn't like that, and they start screaming, they start kicking, they do whatever they can to get back to mom. Mom is crying, kid is crying. Both are unhappy. We're wheeling the child back to the operating room. Now we're holding the child down and putting a face mask on the child to sedate them. Imagine being on the receiving end of that. That's something we definitely sweep under the rug in medicine, but that's the dirty truth exposed. So if we can avoid that traumatic separation on the parent side and on the kid side, it's definitely a plus. The third thing, an important thing to consider, is cost. It's far cheaper to do things in the office than to do it in the operating room. We use far more expensive medicines. We have a lot more staffing versus being in the office setting where you're not using those medicines. It's a lot more controlled, a lot cheaper. Okay, so we have this procedure, but who is it really beneficial for? Who can actually get a Tula? The right candidate is typically anyone between the age of 6 months to 12 years old. They don't have complicated anatomy, and they can tolerate some things in their ear. We do a good litmus test in the office. We actually put an earplug in the ear. And if they're able to tolerate that, there's a good chance they're able to tolerate the procedure. The other big question is, does it actually work? How does it compare to going under general anesthesia? Well, I'm happy to tell you success rates are fairly comparable. However, the tube retention rates, meaning the time the tube is retained in the eardrum, is slightly shorter compared to operating room placement. Some studies have shown that at 15 months, there's a 50% retention with Tula compared to a 72% retention for ear tubes in the operating room. Above all, in the FDA clinical studies, Tula showed a high success rate comparable to traditional tubes placed in the operating room. So for me, as an ear, nose, and throat surgeon, as you can tell by the video, I stand behind this procedure. I've had a couple beautiful stories, one in particular of a child that was wheelchair bound, that had autism, that the mother refused to have him go under general anesthesia because of the risk it would pose to the child's health. So I made a promise to the mother I would give it a try. The child did a fairly good job of handling an ear speculum in the ear. And on the procedural day, he was fantastic. We got the ear numbed, we popped the tubes in, and within 5 minutes, he was literally out of the office. It was amazing. And from that moment, I knew I wanted to have it as an armamentarium for my patients. And as always, if you have any questions about this procedure or anything in general, leave your comments. Join the community, subscribe. I'm happy to have you on board so you can follow any future videos we have, ear, nose, and throat related. Take care.